Malaria is transmitted by mosquitoes. Millions of cases occur annually, causing hundreds of thousands of malaria-related deaths. Each year, thousands of travelers contract malaria. Symptoms may occur within a week or a few months after being bitten. Your local doctor may be unfamiliar with this disease and miss the diagnosis. Malaria is the leading cause of death in expats. Pregnant women and young children have a higher risk of dying from malaria.
Symptoms can appear from 7 days to months after being bitten by an infected mosquito. The early signs of malaria can be similar to flu. Symptoms include fever, sweating, shaking or chills, headache, fatigue, muscle aches and pains, and nausea and vomiting. Children's symptoms can be even more vague. They might just appear unwell, not eat or cry. A person with malaria can develop severe symptoms quickly. These symptoms may include confusion, difficulty breathing, yellowing of the eyes, dark or little urine, drowsiness, seizures, or coma. Urgent treatment is vital. Without treatment, malaria can be fatal.
Malaria is caused by the Plasmodium parasite, which lives and multiplies in infected female Anopheles mosquitoes. There are 5 types of Plasmodium parasite that infect people. Plasmodium falciparum and Plasmodium vivax are the most common. All malaria can be serious, however falciparum kills more people. The parasite enters the body following a bite from an infected mosquito. It travels in the bloodstream to the liver. The parasites multiply in the liver and are released into the bloodstream. The infected person has no symptoms at this stage. The parasites enter red blood cells and multiply inside them until they burst. This cycle repeats, causing the symptoms of malaria. A blood test is used to diagnose malaria. If Plasmodium parasites are seen, treatment can commence.
When outside, use protective clothing and mosquito repellent. Avoid being bitten by mosquitoes. There are fewer mosquitoes at higher altitude. Keep mosquitoes out by using screens over the doors and windows. Sleep under a mosquito net. Keep places where water collect dry. Residual spray kills mosquitoes. Take your anti-malaria medications as prescribed. While using chemoprophylaxis, you must still prevent bites.
See your travel medicine practitioner well before you travel. During the visit, you will talk about your trip, including if you will be exposed to malaria, whether it's falciparum, vivax, or both, whether malaria is present throughout the country you are visiting or only in part of it, and if you'll be taking any side trips to areas where malaria is present. You will also discuss the length of your trip. Will you be staying in a hotel in a city, or camping in a remote location with high exposure to mosquitoes. Put together, these factors determine your risk of malaria. You'll also be asked about your general health. You will be asked your age, any medical conditions you have, any medications you are taking, if you have taken anti-malarial medication before and any side effects you may have had, whether you are or could become pregnant. Following the consultation, you may be prescribed medication. There are several medications available and you will be prescribed the one best for your trip. Make sure you know whether to take the medication daily or weekly, when to start and how long to continue after you return home. Pregnant women and children can only take certain medications.
Malaria can develop rapidly. Delay in diagnosis and treatment can be life-threatening. Early symptoms include fever, If symptoms are severe, you must go to hospital. Unless you are treated urgently, you may die.